Good afternoon, everyone. We're making a recording that's going to be accessible to parents at the college, and we're doing it this afternoon on the 2nd of September. In this presentation, you'll hear from myself as the Director of Pastoral Care and our Educational Psychologist, Mr. Mitchell Barnes. He's going to provide a bit of expertise or insight into how your family can maintain their wellbeing during this period of lockdown and off-campus learning. We recognise that the lockdown and off-campus learning has extended on for a significant period now. And we want to acknowledge the work that parents have done in supporting both the education of their child and their child's wellbeing during this time. It's been a challenging period for many individuals and many families. This afternoon, we hope that we're able to bring to you a few ideas, a few tips on things that you can be doing within your families during this time and for the extended period that will be in lockdown and continuing with off-campus learning. And we're hoping that there'll be some take-homes for you or people in your family that are going to be able to support them and their well-being. So I'm going to turn over to Mr. Barnes now. My role may be at different points in time to chip in or ask questions or contribute. But the bigger role that we play is being a point of connection here at the college. So if you or anyone in your family, particularly students at the college, are struggling during this time, we encourage help-seeking practices. And we know that for students at the college, the best way for that to be achieved is through contacting the pastoral care coordinators. In T to 4, Mrs. Ma; in 5 to 8, Mr. Howling; or in Year 9 to 12, Mr. Van Netten. So I'm going to turn over to Mr. Barnes now. Thank you.
Thanks, Liam, for that. So I'll just bring up the presentation for us to look at. So today, what we're going to be looking at, talking about a little bit, is maintaining well-being during lockdown, how we can do that, some of the barriers, I guess, to maintaining our well-being during lockdown, as well as some tips and strategies for how we can do that better and more effectively. This presentation, has the purpose, the goal of giving some tips, some ideas for doing that for individuals and for families and family units as a whole. I think it's important to understand that, as much as we would like this presentation to kind of fix all the problems that people might be having, that's not really a realistic goal. So again, this is just going to be some very general tips of why things are happening this way and how we can do it. If you do feel like you need some extra support, I'll link some resources at the end of this presentation as well to some external resources, websites and phone numbers and things like that, if you feel like you need that extra little bit of support. So what I wanted to start off by saying is that everyone is going to be feeling different things at the moment. Some people might be feeling angry or confused, frustrated, upset, lonely, sad, and all of those feelings are valid. It's understandable to be feeling those things at this time, and you're not the only one who are going to be feeling those things as well. The other thing is that if you're feeling more positive emotions, feel like this is a positive experience for you, that's just as valid as if you're feeling negatively. So whatever you're feeling, it's understandable to be feeling that as well. I know that some people I've been talking to have been feeling guilty about being in this lockdown and it being worse than the previous lockdown. Maybe they're feeling worse, they're finding it more difficult. This lockdown, it's a second long lockdown that we've had in New South Wales and Sydney. If you're feeling it, if it's affecting you a little bit more than it did the first time, then that's totally understandable as well. What I wanted to do first off is just check in, see who might be the most vulnerable people at the moment to be struggling with well-being or having some difficulties. Obviously, if someone doesn't fall into this list and they're still struggling, they might still be vulnerable, but this is just a bit of a list of maybe people, whether it's in your family, your children, or partners, or, you know, friends, people outside of your family, people to kind of keep a close eye on, be vigilant about when you're talking to them, and making sure that they are getting the support that they need. So obviously the main one is anyone who's struggling with loneliness or social isolation, especially people who maybe are living by themselves or living in a situation where they don't have a lot of close family or friends around them. Obviously, this time can be difficult for them. Anyone who's got pre-existing mental health and behavioural concerns, obviously this time, this added stress, added anxiety can be tough for them. Special needs, people who have special needs, especially in the context of schooling, people who have special needs, special educational needs, special learning needs, they might be struggling at the moment and they might be vulnerable. People who are grieving losses or just the disruption. In the context of the college, obviously year 12 at the moment, have lost a lot of things that they would probably have been looking forward to. So yeah, it's important to remember that feeling might be coming across as grief, you know, losing things like big graduations and formals and things like that, even though, you know, they're postponed and we're hoping to be able to run some of those things later on. Having that uncertainty might be hard for them. People who experience school as a protective factor, some people might be view school as a place where they can, you know, get away from other negative experiences that they're having in their life. They have lots of friends, lots of people that they can talk to at school. People who have, you know, had that taken away from them they can struggle. And people who are separated from family for any reason, maybe they are in a situation where they live across two houses and they haven't been able to see one parent or another parent for a long time because of lockdown. They might be struggling as well. So, like I said, this isn't an extensive list, but it's just a good idea to keep an eye on people who are maybe fall into this list. As I go through this presentation, some people might pop into your mind that fall into this list who might need a bit of extra support. And it's a good idea to just be extra vigilant with them. So I'm going to be talking a little bit about self-care today and how you can do that, as well as how you can make sure that other people are looking after themselves as well. Self-care is the practice of taking an active role in protecting and improving your own well-being and happiness. And it's especially important in times of increased stress and increased anxiety. By looking after yourself, you are looking after your children. Sometimes I know a lot of parents put their children before themselves, which is what people are expected to do sometimes, but sometimes you need to look after yourself before you can look after your children. Sometimes self-care can be mistaken or misunderstood as being selfish. And that's, you know, it's a common misunderstanding, but it's not, doesn't really apply. They're not the same thing. Selfishness is improving your own position in life to the detriment of others, whereas self-care is more about replenishing your own resources while not taking away from anyone else. So it's not selfish to look after yourself. It's important to look after yourself. And as we go through, I'll be touching a little bit on self-care as I bring up certain scenarios and situations about how we can practice self-care in a really responsible and a really positive way. So I've already touched a little bit about this stress and anxiety. Sometimes people use these terms interchangeably. That's totally understandable. For a lot of people, it can mean the same thing or similar things. But there is a difference that I will be, if I talk about stress, I'll be mainly talking about response to external factors. So people can get stressed about, exams or a job interview or a first date, meeting someone new, things like that. They're all stresses because they come from an external factor or situation. But anxiety is an internal or persistent feelings of dread or apprehension. So a lot of times it's going to be maybe not in response to anything in particular, but it's still something that you feel inside you. And that persistent, I guess, feeling is what really, one of the things that differentiates it from stress. So obviously COVID-19, lockdowns, all of this stuff are going to be producing stress, but it's also going to be magnifying some anxiety for many of us as well, whether that's children, parents, anyone who's living through this. The anxiety is going to be magnified and increased. So that's important to consider as well. Not all stress is bad stress. Not all anxiety is bad anxiety. The important thing to remember is that it's how we deal with that stress and anxiety, how we manage it, and how we respond to it. So as you can see on this little graphic here, up the top, there is some positive things that we can do how we react when we're faced with stress and anxiety. A lot of these things are to do with, the fight or flight response, that increase in heart rate, increased muscle, increased strength to muscles, things like that. A lot of people at the moment are probably living in that middle section where they're at the tolerable stage of anxiety and stress. It's a serious thing and it's affecting them, but they're able to partake in things, in strategies or in tips to give them that temporary relief. And it's also helps that they're surrounded by a support network of relationships that are able to really, really, understand what they're going through and help them through that sort of thing. The part when it gets really, really bad and can have a big impact on our lives is when we slip into that bottom one where we're getting a toxic relationship with stress and anxiety, I guess, where we have that prolonged activation, that prolonged exposure to things that are making us feel stressed, and we're not putting in place those strategies, or we don't have those support networks to protect us from our stress and our anxiety. It's a good idea to maybe think a little bit about where you are at the moment, because if you are down in that toxic level, it can be hard to care for and manage your stress and anxiety, and also care for other people as well. So hopefully today I'll give you some tips and some strategies to move up into that tolerable level. And then obviously, it would be good if we could all live in that positive level all the time, but because of the times that we're living in at the moment, it might be hard. But so just think about how you can get from, maybe you're already intolerable, which is great, but how you can get from the toxic up to tolerable is something I guess we can think about as we're moving through the presentation. For adolescents, there are some signs of stress that we can be on the lookout for. So for children who are going through this, obviously they're going to be feeling some stress and anxiety. Some signs to look out for to maybe like indicate that they're feeling, that children are feeling especially anxious is irritability and agitation, some withdrawal, difficulty focusing in class or even outside of class, maybe in conversations and things like that. Decreased motivation, again, could be related to schoolwork, but it could also be related to other things. Changes in sleep and eating patterns or mood, trouble concentrating and remembering things, or impulsive and increased risk-taking. Now, you might look at this list and think that looks just like an average teenager for some people, but it's important to remember when looking at this is we're looking for any change in the behaviours of the children that we're caring for. So, for example, if someone is feeling irritable, but they're feeling more irritable than they would normally be, then that would be something to look out for. If they're feeling more withdrawn, if their changes to their mood are maybe more severe or happen more frequently as well, that's something to keep an eye on as well. So yeah, just something to look for those changes in behaviour, and also those changes will be able to help us identify if they're feeling stressed. Obviously as well, this is, I've said for adolescents, but this can be for adults as well. So that's something to keep an eye on as well. It's just that, like we said, obviously I'm an educational psychologist, so I was looking mainly at adolescents, but this can be signs of stress in adults as well.
Mitch, I'm just going to interrupt you there. Thanks for the presentation so far. I'm just going to suggest that you continue, but perhaps turn your camera off just at different times that may be impacting on the recording. So just advice there. We'll see how we go.
Yeah, so camera off?
Yes, please.
All right, I'll just have to stop for a minute. All right, we'll keep going. Another sign of stress or anxiety can be unhelpful thinking patterns. What these look like, obviously the things that I was talking about before were observable, things you could see. Unhelpful thinking patterns are things that we can get caught up in a little bit and make us, have our minds think of these things that aren't helpful for us in our daily lives. These will be harder to spot, obviously, because they're not observable, but through talking to people and listening to them, then you might be able to understand if people are going through these sort of things. Some common unhelpful thinking patterns are catastrophizing. So that's kind of making mountains out of molehills almost, making, the thing that's happening is the worst thing ever. So maybe someone has failed a test and they think I'm going to fail the whole course now or something like that. People labeling themselves, particularly things people give themselves labels of, I'm not smart, I am a loser, I'm a failure, I don't have any friends, all that sort of stuff. That can be unhelpful. Fortune telling. So this is about people kind of trying to predict the future and making them think that they are, them thinking that, something is going to happen. And so maybe they change their behaviors. Mind reading, it's a similar one. They think that someone's going to react a certain way, and so they change their behaviors to do that. And all or nothing thinking, which is, it's self-explanatory. They think that everything's going to happen or nothing's going to happen, and there's no kind of middle ground. There's no in between. Some helpful responses, if you notice that someone is having one of these unhelpful thinking patterns, is to first off identify the problem thoughts that they're having, identify the thoughts that are causing them stress or are causing them concern. And looking for evidence to challenge this is really important. So for example, if we use the exam example for the catastrophizing, looking back and seeing, have they ever failed an exam before or done poorly in an exam before? Did that cause them to fail the whole course? Or did that cause them to drop out of a course or things like that? Suggesting some alternative explanations. So maybe they did fail just because they were having a bad day, just because, maybe they didn't understand the questions that were asked completely and things like that. And making connections between change thinking and feeling better. So hopefully after going through those steps, they're able to have some more helpful thinking patterns, and that's able to give them a bit of a boost in their mood as well. Through all of this, I'm sure you've probably been thinking and understanding that parents will sometimes need to be, like this example says, a lighthouse. This is a quote from Dr. Kenneth Ginsberg from his book, Raising Kids to Thrive. And it says, parents should be lighthouses for their children, visible from the shoreline as a stable light or beacon. A lot of times when kids are feeling stressed or anxious, they might be feeling stranded. They might just need that anchor to bring them back into their lives and bring them back into the present moment. And that's what parents can do. There's a number of different, I'm sure you've seen this or an example like this, a number of different parenting styles that we can do, that we can implement when we're going through life. I like this one in particular because the one that we should be aiming for, I guess, is that top right corner, and it's labeled the good enough carer. I like that label because a lot of times people will be striving for perfection. They won't let themselves make any mistakes. And that's not realistic. So having that label of good enough means that, you know, you're striving to do your best, but it doesn't matter if you don't reach those heights that you would put in place for yourself as well. So obviously there with the good enough carer, it's a lot of things that if we're able to do these things, we're going to be able to increase the well-being of children in our lives. And as well, you know, you can, obviously this is for parenting styles, but you can take this into any other relationships as well. And we can have a good idea of how we're going and how we're supporting each other by looking at these things as well. So what are some ways we can reduce stress or anxiety, especially, you know, if we are parents and we're looking at supporting our children? The important thing is to try to focus on things you can control, rather than worrying about things that are out of our control. At the moment, the big thing that's out of our control are things like rising case numbers or the length of lockdowns that we're having. If we focus on that and that leads to our increased stress, then that's just not going to be able to be helped, I guess, because we don't have any control over that sort of stuff. The things that we can control, things like postponing any major life changes or decisions. That might be causing a lot of stress for people, but postponing those might be helpful if that's realistic. Resolving any personal conflicts is a big one, especially if you're living with someone that you have a personal conflict with. If you know you're not able to get out of the house, you're in these tight quarters with people, resolving any personal conflicts is helpful. Doing the things you enjoy is going to be really helpful for that, not just for you, but your kids as well. Keeping family routines, any sort of routine is really, really helpful at the moment, but keeping a family routine, maybe, you know, I know personally for me, I usually have dinner every Friday night with my family. Obviously that can't be, they can't do that at the moment, but we still keep that Friday night and have a Zoom call together and things like that. So just keeping that family routine might be able to anchor yourselves in a situation or something like that. Controlling your workload, a phenomenon that has kind of become more prevalent at the moment is something called work creep, where, you know, maybe you work 9 to 5, and if you're in the office, you leave the office at 5, and, you know, you just don't think about work, or it's not going to be part of your mind. But now working at home, you can't really leave your office. So you're stuck in, maybe you're replying to emails past when you normally would, or you're accepting meetings that'll go a little bit over when you would normally finish. That's not great for our workload and our work-life balance, which is important. Managing overexposure to COVID news is a big one, especially for kids who maybe don't understand what's happening, or don't have the full picture of what's happening. Obviously, we want to explain to our kids what's happening and what it all means. But there's, I guess, a point of diminishing returns where we have that overexposure. Getting support is really, really important as well, not just for individuals, but maybe for a family as a whole. There's a bunch of, like I said, I'll list some resources at the end. And also remembering to relax, remembering to take time out to do simple things like breathing exercises, muscle relaxation exercises, things like mindfulness, or, you know, if you want to get a little bit physical as well, yoga, that sort of stuff, which will help you relax and help you to reduce some of that stress that you might be feeling. This is a really simple example of a breathing exercise. And I like that it has a bit of a visual guide as well. So it helps keep you focused and keep you concentrating on the exercise. I just, you know, typed into Google breathing exercise and this came up, and there's a lot of different ones that you can look at as well. So it might be a good idea to have a look at those and see what works best for yourself and what works best for your family in terms of that. And there's a lot of different mindfulness things you can look at on YouTube and through apps and things like that. That's one of the most well studied and proven ways to reduce stress is doing these sort of activities and things like that. Now, obviously, working from home, there are a number of unique challenges that a lot of people haven't had to deal with before, or maybe ever having to deal with in greater numbers, greater volume. So I think we're all kind of learning about this together. We're all working through this together. It's important to set realistic expectations of yourself and your children at this time. Like I said before, if we go back to the parenting styles that I had a couple of slides ago, aiming for good enough is totally acceptable in this situation. A lot of people might be aiming for perfection in terms of them doing all their work, and then they're getting their children to stay on task and do all their work in their online learning. That might not be realistic for a lot of people. So it's important to set our realistic expectations for everyone in the family. It's also important to remember that tensions in the home might be a little bit higher than normal, and this is totally expected and it's natural, whether that's things like reduced personal space, increased stress, like we've been talking about, increased boredom, maybe, especially for younger kids who maybe are used to going out a lot to the park or over to friends' houses and things like that, which can lead to disconnection from friends and things like that. It's just really important to listen to what everyone is going through and listen to how everyone is feeling. One way that you could do this is having regular kind of check-in meetings where maybe once or twice a week you kind of sit down with everyone and say, how are you going? How's the current situation going in terms of where you're sitting, where everyone else is sitting? Are you feeling like you're getting too distracted because, a brother or a sister or a parent is sitting close to you? What can we do to change it so you are, being as effective as possible in this situation? In terms of online learning, it's important to remember that, you're there to assist, but you're not there to teach. It's important to remember that the teachers are, they're going through the same sort of things that we're all going through. They might be feeling stressed. They might be feeling overly anxious about teaching online and things like that. So it's important to support your child's teachers, but then also, help your children to learn as best they can, whether that's making sure that your children are on task or making sure that your children are taking, screen breaks when the teacher has scheduled them, and, actually getting outside into the sun. Those sort of things as well can be helpful for people. One, I guess, strategy that I know a lot of families probably are already using or have started using is positive reinforcement. The example that I've come up with here is a reward chart. This is obviously, mainly related to chores and things like that around the house. But if you are able to make a reward chart for getting through lessons on time, doing as much work as they can in the allotted time that they're given, and also rewarding them for taking those breaks, rewarding them for going outside and playing in the backyard for a little bit, rewarding them for making an effort in terms of talking to their brothers and sisters and connecting with people as well. Sometimes kids might need that little bit of extra support, a little bit of extra push in terms of rewards. So that's, again, just another example. I just Googled, reward chart and was able to make one up pretty quickly. So it's pretty easy to do, and you're able to, hopefully implement it quite easily as well. Now, for a couple of other things before we finish up, I just wanted to touch on some things that maybe aren't as focused on in terms of well-being, but are also important and important for everyone in the family as well. The first one is sleep. Sleep's a fundamental thing that everyone has to do, and it ensures our own mental health and well-being as well. The amount of sleep we get is important, but so is the amount of good quality deep sleep, which is, a stage in the sleep cycle where we're getting the most beneficial quality sleep. Our quality of sleep is often affected pretty heavily by stress and anxiety. So obviously at this time, it's going to be difficult for some people to get that good quality sleep. But some ideas to help you get more deep sleep and more good quality sleep are doing calming practices before bed. So not only doing them during the day, but maybe taking 5 or 10 minutes to do a breathing exercise or mindfulness or something like that. Having a good routine, a good bedtime routine, maybe, an hour, half an hour before bed, where you are doing the same thing every time. That kind of gives your brain the subconscious idea that, it's time for bed. I'm going to start getting ready for bed as well as my body getting ready for bed. Obviously, in families where you have a lot of different age children who have different bedtimes, that might be difficult, but just trying to be as realistic as possible about that. And the other thing is getting out of bed is really important as well. I know, especially working from home, sometimes it is a little bit tempting to just stay in bed and answer emails from bed to start your morning off or things like that. But it's important that we help and train our brains to make sure that our brains understand that bed is for sleeping, and when we're out of bed, that's our time when we're not going to sleep. So avoiding doing any sort of work or other activities except for sleep in our bed is important. The next one is nutrition. So maintaining regular meal schedules is really, really important, especially, if we are working from home. Oftentimes we might work through lunch because it's just easier to do. We need to get that report done, or we need to make that phone call. So we just work through our lunch breaks, which is detrimental to our overall well-being. Having obviously a balanced diet and keeping hydrated is important. And at this time, where we're all home a lot, having maybe a cooking roster or something where families are really participating in that cooking and making it a shared experience might be a really good idea as well, so that everyone's contributing and everyone is having a chance to get together and do something together with that has an end result, that has something that they're looking forward to at the end. Exercise and movement obviously is very important, especially if you're living in one of those LGAs of concern, or even if you're not. It's there are some pretty strict guidelines in place at the moment. 30 minutes a day is ideal, and we have to model this by our own choices as well. If our kids or the people that we look after don't see us doing this, then they're less likely to do that themselves. So it's important that we model any of these things that we've talked about. It's important we model them to our children as well. There are a bunch of different ways to kind of keep motivated for exercise and movement. Some of the things, you could use, there's a bunch of different apps, YouTube clips, TikTok dances, things like that are focused on the enjoyment of exercise. And like I've said, they're just maybe getting out of the house, having an excuse to go out of the house and walk around the block might be a positive for a lot of kids. And it might be helpful to focus on the benefit as well. The benefits of exercise, the benefits of movement, like increasing fitness, improving our mood, aiding our mental health, things like that. Now, just to finish off, I understand that, some of these things you may have heard before, And sometimes we know the right thing to do. We know what we're meant to be doing to look after our own well-being, but it's hard to be motivated to do that sort of thing. There's two types of motivation, two main types. The first is positive motivation, so focusing on the positive things that will happen when you take an action, and negative motivation, focusing on the negative backlash that will occur if you don't take an action. Depending on your personality and what the thing that you're trying to be motivated for and things like that, either of these things might work, either of these approaches. So it's just important to really look at your own circumstances, or look at how you've been motivated in the past and figure out which one will work best for you. There are some ideas to stay motivated. The first one is celebrating the little things and rewarding yourself. That kind of ties in nicely to the next one, breaking big activities down into littler ones, achievable steps, and rewarding yourself, giving yourself little rewards when you achieve each of those steps. Staying connected with loved ones can be really, really helpful. Using things like Zoom or Facebook or things like that to kind of stay connected, stay accountable with each other. But then as well, switching off from the digital world might be helpful for some people if they want to, really focus on something at work, but they've always got their phone next to them or something like that. That can be a bit of a distraction. So switching off from that. Prioritizing personal development might be a good idea at the moment. People maybe have some free time where they're not dealing with, driving to and from work or something like that. They have a bit of free time. A lot of times we fill that free time, or have the tendency to fill that free time with things like going on social media and things like that. But if we are able to prioritize our personal development and see that we're actually achieving something with that time, we might be motivated to continue doing that. Planning how we're going to do things and what we're doing is always really, really important, as well as sharing our goals with someone. That might be about, keeping us accountable, or we might be competing with other people and things like that. But just letting other people know what you want to do will help you to kind of keep on track with that sort of thing. Another good way to get motivated is figure out your own values and your own passions. Some of these questions you might already know the answer to, but some of them, they might help you, might give you a bit of a head start into figuring out what motivates you, and then using that motivation to figure out how to keep up with all this, all these things that we've been talking about at the moment, and increase our well-being. So a couple of questions I've got up there. What inspires you? What do you love to do? What would you do with your life if you could do anything? If you had all the money in the world, what would you do with your life? And what do you want to achieve in this life? That might be helpful for people to, like I said, before prioritizing our personal development, figuring out what drives us might be helpful to increase some of our motivation at this time. Like I said before, all of this stuff, it's a bit of a general overview. Hopefully it'll give you some ideas, maybe kickstart some things in your life and in your family's life, to increase your well-being at this time. But there will be times when we need to seek some professional help and professional support. These are some examples of when we might need to do that. If we're feeling, if we or our children are feeling sad, persistently anxious, that anger, worthlessness, all of those sort of feelings, those negative feelings are just not going away and are having a big impact on our life. If we notice significant impairments or changes in our functioning, such as, increased sleep, not able to get out of bed, not having any appetite or hygiene as well, increased impulsive, reckless or risky behaviors, and as well recurring thoughts or expressions about death, dying, and or suicide. So if you do need that extra support, Luckily there are a bunch of resources online. I've listed some web addresses there: Beyond Blue, Reach Out, Black Dog Institute. They're all good in terms of getting some resources, getting some extra information about these things, as well as, Child Mind, Raising Children, Headspace. They have some good resources on parenting in particular, how to help children when they're going through these things as well. And then a couple of numbers that you might find helpful. A kids helpline, especially for, children, 1-800-55-1800 can be really, really helpful. Lifeline, 13 11 14. The coronavirus health information line, if, maybe kids or maybe yourself need a little bit of clarity about things in terms of, what we can and can't do, risks in terms of vaccines and things like that. That's all there. And then if anyone is feeling, has those thoughts of suicide, the suicide callback service is really, really helpful as well. So that's the end of the presentation. I hope you got some good things out of it, and hopefully you are able to, get something out of it that will help you and your family moving forward in terms of wellbeing.
Thanks very much, Mitch. I want to acknowledge Mitch's presentation and the work that he's put into that for our college community. It's a great resource to have somebody with his expertise working at the college and supporting students and supporting staff at the college as well. I just want to reiterate a couple of points, particularly around more serious issues to do with wellbeing. Mitch, in his presentation there, identified what that looks like and the help seeking that should be undertaken in such circumstances. A reminder what I said at the start of the presentation about reaching out to the pastoral care coordinators at the college. They will get back to you and they will continue to support you as a parent, but also your child at this time during lockdown. I guess the final thing that I wanted to say as well is that at this time, if you're a person that does have a faith, that it's really important that you continue to turn your concerns, anxieties or burdens over to God. And even if you're not a person that's got a faith at the moment, sometimes people can benefit from prayer at this time or reaching out or exploring that side of things at the moment in terms of finding connection and finding purpose and also finding a hope in terms of moving forward as well. So what I'm going to do is I'm just going to close in prayer and that'll finish our presentation this afternoon. Dear Heavenly Father, Lord, we give thanks for our college community. We thank you for this presentation this afternoon, and we pray that some of the information there will be helpful in supporting students or parents at our college during this time of lockdown and off-campus learning. Lord, we pray that as we continue in this vein, that we'll reach out and support one another. If we're struggling, that we seek help. And if we have faith, that we're turning over our anxieties and burdens to you as well, Lord. And we just bring before you all those things in your precious name. Amen. Thank you, Mitch, and thank you to parents. Hopefully looking forward to seeing you back on campus sometime in term 4. God bless and take care.